series. Welcome, folks, to Season 6, Episode 11 of Gateway Center of Excellence in Rural Health Lecture Series, where we are opening the gate to understanding rural health. Today's date is June 2nd, 2026, and our topic is, Can Smartphone Apps Impact Substance Use and Mental Health? A look at the evidence. Our focus will be the research on digital technologies to manage mental health and substance use. Because rural residents are often spread far apart, effective online resources can help bridge gaps in access to care. Before we begin, it is important to recognize that access to digital tools is not equal across communities. Many rural, remote, and Indigenous communities face infrastructure gaps, creating barriers to work, telemedicine, and education. The Gateway Center of Excellence in Rural Health office is located on the ancestral land of the Anishinaabeg, Haudenosaunee, and Neutral peoples. It is part of the Huron Tract Treaty number 29 and the Saugeen Tract Treaty number 45 and a half. As we discuss digital tools and new opportunities for treatment, Gateway Center of Excellence in Rural Health advocates for ongoing efforts to improve access to care, digital or otherwise, in rural, remote, and in Indigenous communities. My name is Maddie Cardno, and I am a research assistant at Gateway Center of Excellence in Rural Health, and your moderator for this webinar. I am enthusiastic about introducing our speakers. They include Dr. Michael Beazely. He is an associate professor at the University of Waterloo's School of Pharmacy and the Dean of Graduate and Postdoctoral Studies. He also acts as a research chair for Gateway Center of Excellence in Rural Health on rural substance use. Hedaya Al-Qazli is a fourth-year pharmacy student currently completing her clinical placement in the Hamilton region with a strong interest in hospital pharmacy, cardiology, and quality improvement. And Loren Van Ewyk is a co-founder of the National Farmer Mental Health Alliance and a PhD student at the University of Guelph in Rural Studies. With a drive to support agricultural workers and promote resiliency, her organization has developed a new application to support farmers' well-being with the support of Agriculture and Agri-Food Canada. The views and opinions of speakers in this webinar may not reflect Gateway Center of Excellence in Rural Health, but we believe in providing a platform for meaningful discussion. So with that, I will pass it on to Mike.
Thanks so much, Maddie. And thanks for everyone viewing here today. It's my pleasure to be here, and we've got a really interesting talk, and we'll come at it from a couple of different angles. We'll talk about the emergence of smartphone apps and health in general in the areas of mental health and substance use. Hedaya will present some research she did last term on what we know about the evidence for digital health technologies, specifically in rural jurisdictions. We'll go through a few quick examples, and then Loren will talk about the Bee Farm Well app at the end of the talk. So for those of you who have viewed this lecture series before or have been involved with the work at Gateway or live in rural communities, one of the challenges when we're talking about health is access to services. And that can be a challenge because a lot of especially advanced specialized service provision tends to be centralized in large urban centers. And that's true as well for mental health and substance use supports of many kinds. But that doesn't mean we can't do great work in those areas in rural jurisdictions. So we can use pop-up clinics, mobile outreach teams. We can use telehealth or virtual appointments for medical or counseling. There's local, provincial, and national helplines for various types of crises. And many of us are carrying around a smartphone, and so there's smartphone apps that can also be accessible whether you're in a large urban center or in a rural jurisdiction. So I've been interested in smartphone apps and the intersection between them and substance use for a while, and I was really interested to see this publication by the Canadian Network for Mood and Anxiety Treatments in 2023. This is one of those groups that brings a bunch of doctors and researchers together. You can see all of these people contribute to this. They look at all of the evidence um, for drug treatment of mental health or substance use disorders, for counseling and various types of psychosocial treatments. And they sort of synthesize it all into one spot and kind of help prescribers and other service providers and clinicians to sort of get a sense of how do I start to approach treating people with, in this case, depression. And if you read this paper, there are all sorts of tables like this. And this is the type of stuff as a pharmacy prof I'm used to looking at, where they take all the antidepressants and they sort of try to group them into use these ones first. Those are usually the ones that have the best evidence and maybe the fewest side effects. And then second and third line, either they might not have as much evidence or maybe they have more side effects. And so you can still use them, but you might use them later. And for the first time in 2023, they included not only tables about drugs to use for depression, not only evidence about different types of cognitive behavioral therapy or other counseling approaches to use for depression, they included some specific recommendations about digital health technologies or digital health interventions, DHIs. And so they listed a few, and you can see a few listed here. They described what these digital health interventions look like. And they even talked a little bit about some evidence that supported the use of these digital health technologies. And you can see here they grouped them in this table into ones that were facilitated. So you're using a digital health intervention alongside a clinician or a service provider, or unguided or self-directed digital health interventions. And they even went so far as to kind of suggest how to use them. Can you use them on your own? Do you use guided ones first? Do you combine them with various types of therapies and that sort of thing? So we had these apps. They've been around as long as smartphones have been around. Um, and we had a growing body of evidence that they were effective. They're something that is potentially very accessible for folks in rural and remote jurisdictions. And so I was really interested in what the evidence said about that intersection, about the use of digital health technologies in rural jurisdictions. And I had the great pleasure of working with Hedaya last term, who was one of our outstanding pharmacy students, who really took this question and went with it. And she's going to tell you about her research.
Thanks, Dr. Beazely. So for the next section, as he mentioned, I'll be discussing findings from my scoping review that we conducted examining digital health intervention technologies used to support mental health and substance use care in rural and remote Canadian communities. Next slide, please. The motivation behind this work is pretty straightforward. We know that rural Canadians experience significant barriers to accessing mental health and substance use services, namely geographical isolation, provider shortages, transportation channel challenges, stigma, and long wait lines all contribute to the gaps in care. At the same time, we've seen a rapid expansion of digital health technologies over the last decade, especially after COVID-19 pandemic. So we wanted to better understand what technologies are available and what population they serve, the rural setting, and what the outcomes have been reported. Next slide, please. So for this review, we searched the literature published between 2012 and 2015, focusing specifically on rural and remote communities in Canada. We included studies involving digital health intervention for mental health conditions, substance use disorder, or harm reduction services. After screening the literature, we identified 37 studies that met our inclusion criteria. The studies varied considerably in design and included randomized controlled trials, qualitative studies, mixed method evaluations, programs, and observational research. One thing that became pretty clear to me very quickly is that evidence-based is still relatively early. It's still in a relatively When we looked at the type of digital health interventions being used, we saw telehealth and video conferencing dominating the literature. This included virtual psychiatric
Yeah, Hedaya, your
consultations,
signal is
counseling services, telepsychiatry programs, and virtual addiction treatments. Is this any better?
yeah, I'm wondering. Yeah, we'll give it another shot, and if not, we'll turn off your camera, see if that helps. But go,
Okay.
keep going.
Okay. So when we looked at the types of digital health interventions being used, telehealth and video conferencing dominated the field. This included virtual psychiatric consultation, counseling services, telepsychiatric programs. Yet there was also some smartphone applications and virtual overdose monitoring services, internet delivered cognition. I think, is this a common issue? Are you hearing me better? Would you like me to turn off my camera at all?
Yeah, you're getting a little slow at times, so maybe try turning off your camera and see if that works.
Okay. Okay. Okay, let's see. So what was interesting to me when I looked at the different types of technology being used is that most interventions weren't trying to replace healthcare providers. Instead, they were simply being used to extend access and service to those in isolated regions of Canada. Next slide, please. Next slide, please. Oh, yes. Yeah, this one. Thank you. In terms of population served, there was quite a bit of diversity. The studies included youth, older adults, Indigenous communities, individuals living with substance use disorder, people with depression or anxiety, and patients requiring specialized psychiatric care. And yeah, despite this diversity, there were still some important gaps that we need to highlight. Many rural populations remain underrepresented in literature, particularly Indigenous communities where culturally grounded and community-led digital interventions are very important and relevant. This highlights an important point. Technology alone is not enough. And so successful implementation requires an approach that is culturally safe and tailored to the needs of specific communities. Next slide, please. I'm sorry, next slide. When we looked at facilitators of the use of DHIs or digital health technologies in rural Canadian communities, we found that reduced travel and improved geographical access was a main drive for the use of DHIs, increased sense of safety, privacy, or autonomy, and the growing use of peer or culturally grounded delivery has enhanced the trust in DHIs. And of course, the low cost or free access to the population that is being served and flexibility in scheduling a location has greatly improved people taking up DHIs in rural communities. Next slide, please. When we examined the outcomes, the most commonly reported findings was related to feasibility and accessibility. In other words, researchers were often asking, can people use these technology? Do they find them helpful? Are people more willing to continue using them even after the study is over? And generally the answer was yes. Many participants reported that digital health services were convenient, they were accessible, and were helping reduce the barriers associated with travel and distance and cost. But several studies also evaluated the long-term clinical outcomes, such as sustained improvement in mental health symptoms or long-term reduction in substance use. So there's still a bit of a gap in what the use of DHI look like in the long term and how that impacts patients' outcomes. Next slide, please.
Thanks, Hedaya. Any last comments about your research?
Yes, sorry, I wasn't able to see It's kind of cutting off for me, but that's okay. I just want to say that overall, the main takeaways from this review is that DHI or digital health technologies are showing significant promise for expanding access to mental health care and substance use services in rural Canada. The evidence consistently supports their feasibility and acceptability. Many studies demonstrated meaningful improvements in access to care and better trust in the healthcare providers. And yet, there's still we still have a long mile to go. There's some important challenges that remain, like infrastructure limitation, internet access, sustainability concern, and the need for culturally grounded implementation and care. And so our biggest question really is, how does this look like in the long term, and what impact does it have on the outcome of the patients or participants taking up DHIs?
Thanks so much, Hedaya. The research was excellent, and I certainly learned a lot working with you. And really, what it showed was not only that we have emerging evidence generally for the use digital health interventions, including smartphone apps specifically in general, but also even a bit of emerging evidence in rural and remote jurisdictions. So we've talked a little bit about the sort of academic evidence, but what are we actually talking about when we are thinking about apps on your smartphone for substance use or for mental health? So um, if you pick up your phone and go to your app store and type in alcohol or alcohol cessation or something like that, you'll probably be overwhelmed by the number of apps that will come up in your search. So this is something I typed into the App Store on an iPhone, and these are kind of some representative types of apps that you'll find if you type looking for something around alcohol. So the simplest ones, and these are representatives of them, are some version of a tracker or diary or something like that, where you maybe input some baseline consumption. You maybe set a goal that could be some sort of reduction in alcohol use, or maybe some period of abstinence. And then every day, at the end of the day, you type in number of drinks consumed, and depending on the various apps, they can send you reminders and do that sort of stuff. And then you can look back over the last days or weeks or months and see, to get a sense of your alcohol consumption patterns and get a sense of any changes that you've made. If you do have periods of abstinence or reduced drinking, some of these apps will send you sort of uh, inspirational messages to say, keep going, you're doing great, that sort of thing. Some of these will tell you how much, not only how many drinks you've reduced by, but maybe how many calories you've saved. So if alcohol is a source of calories and you're interested in calorie reduction, they'll say by reducing these number of drinks last month, you saved 900 calories. Or even convert your reduction in alcohol consumption into money saved. So at the end of the month or the week, if you've reduced consumption to some level, it will say you've saved $25 this week or $60 this month. So these are very representative of a very simple, easy app, in this case, related to alcohol consumption. Of course, you can have more uh, apps with more connectivity. Those ones on the previous slide, you can kind of do on your own, um, at your own pace. Others will connect you with other individuals that have the same goals. So that could be alcohol reduction. In this case, it's an app to connect you to people trying to maintain sobriety. There's apps that will, if you're in a 12-step type program, there's apps that will connect you with other members of that program for support, not only locally, but maybe if you're traveling, you can use those apps to connect with others. And then there's apps that may have about other substances and for other target audiences. So for example, the Stop Vaping Challenge app is a Canadian app, targeted at youth, to reduce or abstain from vaping nicotine. DOORS, of the Digital Overdose Response System, is a harm reduction app for people who use opioids. So that just gives you a sort of little flavor of the types of apps that are out there for related to substance use. For mental health, there was a few that I showed earlier in the table from that paper. One of the ones that is probably better studied than others is something called PTSD Coach Canada. You can find apps for all sorts of mental health conditions, depression, anxiety, specific anxiety disorders, in this case, like post-traumatic disorders or symptoms of post-traumatic stress. This was originally developed in the US by the Department of Veterans Affairs. It was originally targeted at combat veterans in the US military. It was adapted by Veterans Affairs Canada, and then further adapted so that it's really not military specific. Anyone experiencing symptoms of PTSD, for whatever reason, have used this app. Like many mental health apps out there, they're often based on a specific type of therapy, the most common being cognitive behavioral therapy. And this app would include techniques for emotional dysregulation or periods of stress or panic that may arise in individuals with PTSD. There'd be breathing exercises, grounding techniques, coping strategies. And this one actually also has a substance use prevention and substance use component. And we're actually thinking about using this app as a recommendation for one of our programs here at Gateway called the Brave F program, or the Benefiting Rural Area Volunteer Emergency Firefighters. That program started and still is primarily a cardiovascular risk screening intervention for our rural volunteer firefighters. But we've also incorporated a bit of content around mental health and incorporated a short screen called the PCL5 screening questionnaire that actually identifies some symptoms of PTSD. And we know that emergency responders of any type, including emergency volunteer firefighters, have a much higher incidence of things like PTSD than the general population. Another program that you might be familiar with, if you're familiar with Gateway, is the Farmers Safety and Wellbeing Program. Probably one of the most well-known parts of that program are the shed talks, but there's all sorts of farm safety programming involved there. And this is a great segue into bringing Loren in to talk about an app she's been helping to develop for farmers specifically.
Thank you, Dr. Mike and Dr. Mike, I'm sorry, Beazely, and for the rest of the Gateway team. It's such a pleasure to chat with you. We're very excited about this app. If you were to Google or go to the App Store and type in farmer, the first 13 apps that populate are games or farm simulator, tractor driving simulators. And then there's a dating app, and then there's another about 8 apps that are games. And so what we have found is there's very few apps specific for the agriculture industry. And as you know, post-COVID, for instance, self-reported of rural women's wellness experienced the greatest decline. That's a research done by Dr. Leith Deacon at the University of Guelph. And so we see the tide changing when it comes to mental health in rural communities because of folks like Gateway and for all of the advocates across Canada and beyond. But we still have some very real needs in our agriculture community. So the app that we've developed is actually a twofold app. So number one, it's for farmers. And it's also for therapists working with those in the rural community. Go ahead, Mike, and change the slide there. I'll talk really briefly about the National Farmer Mental Health Alliance. Our goal is to ensure that farmers, their families, and the communities that they live, work, and play in have credible resources and are able to thrive. And so with that mission in mind, we participated in the agri-food industry mental wellness. It's a producer mental well-being challenge. And we were awarded the $50,000 along with 19 other organizations. And it's a 3-tier funding model. And so we are hopeful that the second one will also will be successful in the next round as well. Our company's built on 4 pillars. I don't know if you can hear in the background, but my foster daughter is over there going, "Best day ever!" So if you hear that, it's just because she can see me. It's okay, everybody. So our organization produces agriculture-informed therapy. It's fully certified. We also provide direct counseling services. So we train therapists, and we also provide direct counseling for farmers. We participate in research, and I'm thrilled that I've had the opportunity to meet Dr. Beazely, and hopeful that we'll be able to team up again in the future. And then we also work with stakeholders in agriculture, as well as, for instance, the Ronald McDonald House, and working with their fundraising efforts. Couple of our current projects, as I mentioned, the agri-informed therapy. For anyone in southwestern Ontario, know about the Three Oaks Respite Cabin. Our organization provides follow-up services, so they're able to access some counseling services. It's for farmers and for first responders, so similar in mandate with the Brave F program. Our goal is to ensure that folks have a chance to get away, to recalibrate, and to really just focus on their wellness for a couple of days and feel supported in that process. We just finished up our first grief after suicide support program. We are starting a grief, not just post-suicide, but a grief program in the fall as well. One of the most consistent themes for farmers is the level of grief that they carry. And that's for multiple reasons. We have, grief due to loss of a family farm sometimes, or our children not wanting to take over the family farm sometimes. For those of us who raise livestock, I raise livestock. We raise sheep. We also have an on-farm bakery. And I remember the year when 75% of our lamb production died. And so there was a grief process that goes with that. And on multi-layers, there's this human, animal, emotional connection grief, but there's also a business expense or a business expectation that also suffered grief as well. And then we come to our Beef Farm Well app, and I'm going to go through and kind of walk you through that app in the next few minutes. This app is expected to launch on the App Store. It will be free for anyone to download. So even if you're not a farmer, if this isn't, kind of like, well, this isn't really relevant to the work I do, I would encourage you to take the time to download it. If it doesn't do anything else, it might help to offer some insight into the issues that farmers face. And so for that reason alone, I'm really appreciative for anybody who takes the time to kind of enter into that world. Now, technology isn't entirely new to farmers. In fact, by and large, many farmers engage readily in technology and technological advancement. Certainly, we have robotic use in farming has been growing, precision agriculture technology. So where we spray, what we spray, and the amounts that we spray can be very specific to the soil samples that are taken. If we've had a drought the previous year, we might have a leftover pesticide residue, and so that's taken into consideration. One of the most interesting things is Meta eyeglasses. Some of the largest group of consumers are farmers because they can watch a video on how to fix something, and have both their hands free. And so, technology itself is not something that as farmers we typically shy away from. We tend to be even our older population of farmers, we tend to see them very determined to access and to utilize and learn technology as well. So that brings me to the app itself. The very first homepage that you will see if you were to download the Beef Farm Well and register your account, the account you'll find is under the My Profile, which we'll get to at the end. So I'm walking you through this as if you've already downloaded and registered it. The very first section there is the Start Your Daily Check-in Routine. And that check-in routine asks you, how was your sleep? How much sleep did you attain? We'll also ask about your mood. There's 4 different categories there. If you're feeling really low versus if you're feeling happy today. Another one is self-care. And we don't use the term self-care. We tend to use other terms such as kind of maintenance or professional growth or growth-minded. And so that would ask you to register that as well. That information is tracked on a daily basis, and this is where the app can work both for those who are in the helping field, so allied health professionals, or for those for farmers themselves. A couple of things that you'll see, and I'll walk you through when we get to the last kind of section, but you're able to look and see, how have I been feeling over the whole month? I've noticed that at the beginning of every month, I'm really feeling stressed and feeling down. Well, why is that? If you're working with a therapist, some of those patterns, and as individuals themselves, those patterns really reveal some significant information as to how we need to target our wellness. Below that, you see my tasks, and right now it's saying must be subscribed to view. I can assure you that that's not the case. You won't have to be subscribed. In the profile, you actually can set goals for yourself for the week. So you want to listen to maybe 3 podcasts a week. You'd like to do a journal entry 3 times this week. Maybe you'll watch some micro modules. So you're able to highlight some of your goals, all targeted towards your identified sense of wellness. Again, those goals could be set with an allied health professional who's helping you and supporting your wellness. Next, we come to our assessment tools. These assessment tools are only permitted to be done once per month. The first one, titled Maintenance, is a personal inventory. It goes through 4 different categories. The first one is your physical health. The second one would be your emotional or psychological health. The third one would be your financial health. And your last one would be your spiritual health. There's a couple of questions there for that as well. Beside that assessment tool, you'll see personal growth, and that is how are we caring for ourselves this month? Are we reaching those goals as well? Below those tools, you'll get to the Knowledge Hub, where we see micro modules and webinars, audio blogs, and podcasts. And you can move over the slide there, Dr. Beazely. And in that Knowledge Hub there's a wealth of information and resources there. Those aspects are from many different providers across Canada. We have webinars that have been done and micro modules done by, for instance, Ian Kubitz. He is kind of a succession planning individual. We have blogs from Caitlin Dubin, who is the Rural Woman podcaster. On the podcast, audio blogs are a whole host of people from across Canada, Brett Gardner and some of those who have recorded their blogs that they've written. Jerry Friesen is another one. So that's an opportunity for people to, particularly when you're spring planting or you're harvesting or you're driving, you're able to listen and really target kind of some of the inputs that you're putting into your own mental health and wellness to assure that they're aligning with the goals and where you hope to be. Below that, you'll see a guided journal. And if you were to click on that open button in the app, it will take you to a guided journal. You're able to talk about what's just on your mind, just kind of do a dump if you need to. And then we kind of push people along to, what are you grateful for today? It's one of the leading ways that we can change our mental health and our outlook is by understanding what we're grateful for. And then what's something that you want to focus as far as your personal growth. Below that, in the tools section, we have coaching guides. So breathing exercises, grounding exercises or stabilization exercises. We have progressive muscle relaxation. We have some guided imagery as well. Those are all provided from therapists that work across Canada as agriculture-informed therapists underneath our banner. And they're super helpful, particularly for people who are either looking to grow their baseline attributes or their baseline skills, or for people who are experiencing some distress and need to exercise, engage a breathing exercise to calm their experience or calm themselves, or for instance, participate in guided imagery to kind of bring them out of a space that they didn't want to stay in. After tools, we get to our resources page. We'll just hit the next slide there. And you'll see the very first thing that pops up is if you're feeling urgent or unsafe, please call 911. So if there's something that's really causing you some distress and you're feeling unsafe or unable to keep someone else safe, then we encourage you to call 911. Below that, we have emergency contact. So if you need to make it to your closest emergency room, and this is specific to an emergency room, not just to a walk-in clinic or something of that nature, then this will guide you to that location. This is obviously close. You can see where I live on this picture, actually. But Petrolia Hospital would be closest to me. If I click visit, it will take me out of the app and into Google Maps, and it will give me directions there, or I can hit the route button at the top and it will show me the map to get to that location. Below that, we've got a couple 1-800 numbers, our 1877 number, and then we have 988 for the crisis line. Below that, you'll see that you can put a safe person in. And the reason for this is we have a number of people who live and experience, unpredictability in their sense of wellness. Sorry, there might be a little bit of noise behind me, so I hope you can still hear me. That safe person, for instance, might be a mom, but I can't remember their number when I'm in this place of panic. But if I'm with somebody or if I'm able to access that contact information, then that safe person is there as well. Below that, you will see a listing of our agriculture-informed therapists. You will see that you can click either in-person, virtual, or telephone. So depending on how they provide services, if you're looking for in-person, if you're not particular to in-person, virtual is fine. You can select that. You also can select you're looking for the person furthest away, or you can select nearest. And the reason for that is we have a number of farmers who don't really want to see a therapist in their hometown. They don't want other people seeing their truck parked outside that therapist's home. I have people who drive an hour away and often drive an hour away to my office to be able to access in-person therapy services. So those and all of the therapists that are provided there, you can go ahead and switch to the next slide. There's another picture. So Virginia, she's in Stratford. All of these therapists have taken agriculture-informed therapy and are certified AIT specialists. That training, as I mentioned, is 12 continuing credit hours. It's a very thorough training. It's a huge commitment for these therapists to undertake, but one they do so willingly, wanting to serve the population. And most often, I would say probably over 90% of us are farmers. We have grown up on the farm. We are currently farming or very directly impacted by the agriculture community. The third aspect is our Barnyard Connect. This is an opportunity. This is for this, even when eventually, if it moves to a subscription format, this portion would always be free because it's a chance for community to connect with one another. If you were having an agricultural meeting, you could create that event, you could list it, and other people would have access to that event. So right now, as I mentioned earlier with Three Oaks, if you were to log on to the app, it would show that Three Oaks on July 18th is having a support day for first responder spouses, an opportunity for those first responders to come and learn about the impact from a mental health perspective on those who have PTSD. We will share some of the resources that Dr. Beazely had shared today as well. Lastly, we get to the profile. You can see there on the settings in the top right corner, you're able to identify marginalized populations that you might belong to. So for instance, if you are a person of color, if you are a woman, those types of identity flags, we call them. And if you identify something, it just means that the resources that populate are more specific to some of the marginalization pieces that you may be impacted by. You will also see at that time, actually, can you just back up one more time there? I'll walk you through. You'll also see progress. So the view of select the weekly goals, you'll see your progress for the weekly goals. And that My Wellness category, I wish I had the picture to show you. It shows you the graph. One of the other pieces is actually substance use is also monitored. So in the very beginning, when you set up your profile, it will ask you if you consume alcohol and if you want to monitor your alcohol use. Certainly there are people who don't drink alcohol at all, and so we give them the option to leave that aspect out. In agriculture, by and large, alcohol is a tremendous piece of our story. In fact, and for every new client, we have a conversation about alcohol use because it has become such an acceptable, unhelpful coping strategy at times, not in every situation. But when our mental health declines, it certainly becomes a mental health strategy or a coping strategy, I should say, that is readily accessed by farmers. Lastly, at the very bottom there, you'll see my rewards. It's because as you participate in these activities, you gain points. So there's a little bit of a gamification. Those points are then added up to your weekly total, and you can cash those in for gift certificates for a local Ontario business of some sort. You can also donate them if you would like to. So that kind of brings us to the conclusion of the outline of the app. We are very excited and we're hopeful that it will be launched within a week, that we will be at that stage. A little bit of a shameless plug for the Rural Well podcast. Be sure and check us out. And thank you, folks, for turning in today. I'm going to turn it back over to Dr. Michael Beazely.
Thanks, Loren. Fantastic work, and I'm really excited to see the rollout and of the app. So we've sort of got a sense that technologies, including smartphone-based apps, are useful and have the potential to be useful in rural and remote settings. They're at the tip of your fingers most of the time, so the support is timely. Many of these apps are free, low cost or low subscription cost, and so they're quite cost effective when they work. They provide all sorts of options for sort of self-directed work that you don't have to really tell anyone about, and so if there's a lot of stigma involved, you can get started on your own. But also connecting you with therapists or other people with going through some of the same things you are via the app. And more we're starting to see some evidence that, yeah, these apps are a good idea. They look great, but they're actually showing that they do work in some cases as well. And so those are all the great attributes of smartphone apps in the areas of substance use and mental health. But it's not without side effects. Just like the antidepressant comes with side effects, there's potential adverse effects or downsides or pitfalls of smartphone apps as well. So there's been quite a few reviews of large numbers of smartphone apps, especially in the mental health area. And some of those researchers have found that although many of them use evidence-based information, a lot of them are CBT-based and other things, a very large percentage don't. And it might not be clear to you as someone who's curious and is exploring some of these apps, which is which, and whether your app is using evidence-based approaches and which aren't. Like with any treatment, so if you're experiencing symptoms of depression, if you start counseling, or if you start drug therapy, or if you start using an app, we know that a large percentage of folks don't continue to be engaged. They stop their medication, they stop going to therapy, or they stop using the platform. And so, like with any treatments for some of these things or tools for some of these things, ongoing engagement can be a challenge. So it was great to see in Loren's talk the inclusion of directions to call emergency services in a crisis. One of the other downsides of some of these technologies, if you look at the literature, is that they do pretty well in many situations, especially sort of mild to moderate depression or various types of substance use, but they can actually not do very well in medical emergencies. And so any app needs to include directions to emergency responders if need be. And like with anything you're doing online, when you're putting information online on various websites or on apps, there's the potential of confidentiality breaches, and those have happened in the past, not commonly, but that's always a risk of working online. So some take-home messages before we stop to answer some questions that you might have. Start with evidence-based apps or recommended apps. So you can just go in blind and do searches, and you can find good tools on your phone. Places like the Center for Addiction and Mental Health or Canadian Mental Health Association or various other places are now more and more, they'll have a web page that will list some apps that either those organizations are recommending or maybe have evidence to support it. I always say start experimenting, not just for yourself. And so if you're interested in any of these tools, certainly start experimenting for yourself, but also if you're a service provider or a medical professional or clinician, download one or two of these to start using them just to get a sense of how maybe your patients or clients might uh, be using these and experiencing them. They're great to recommend during promotional events. So if there's sort of a dry January challenge or a Bell Mental Health Let's Talk Day, anytime there's attention drawn to substance use or to a specific drug or to specific or to mental health, these are great to recommend as part of that promotion because someone can get started right away and it's very low barrier. Try and try again. So especially those drink counter apps I showed, um, many people will start them. You'll read various articles about how many days someone lasts using the app. You might download the app with the best intentions, use it for 2 days and then forget it, or maybe you consume some alcohol and you don't want to input it. But then a week later, try again, a month later, try again, because we know that some of these behavioral changes take a lot of multiple tries before they start to stick. We need more research, clearly. We've got some, and it's growing, but we need more research in general about these apps and for specific populations. And so in one of Hedaya's slides, she was looking at rural populations, but even within that specific population, there was that graph with some were for youth, some were for adults, some were for indigenous individuals, and so forth. Because ultimately what we want to do is match the right app to the right person in the right place at the right time with the right goal. Because that would be the way to get the most success for the most people. And we need to demystify smartphone apps for clinicians and service providers. And this is something I'm working with some volunteers on this summer to try to, instead of taking your 500 alcohol apps, try to categorize them and identify a few with various functionalities so that you're not intimidated if you want to start thinking about making some of these apps as part of your recommendations for your clients or patients. Thanks to Hedaya and her research. Sharon, who's another pharmacy student, contributed a lot to that. Harneet and Prapti did some work on these smartphone app reviews last summer, and Hudson, who's a Waterloo student and from Wingham, helped me with an environmental scan last summer on virtual clinics and helplines in Huron County. I'm sure Loren has hundreds of people to thank or dozens of people to thank as well. These are the references. These are Hedaya's references. There's loads of them because of her paper. And thanks to Gateway and to my fellow presenters today. And we'd be very excited to answer any questions you might have.
Thank you, Loren, Dr. Beazely, and Hedaya for that great presentation. And yes, we'll transition now into a question and answer period. So if you have any questions, please feel free to add them to the question and answer box below, and we'll try to get them answered by our speakers. So I'll start with a question to Loren. In the development of your app, what types of research in collaboration with other agricultural and mental health organizations did you do to make it more effective for people in the agricultural space?
Thank you so much. One of the first things we did is we surveyed a number of the farmers at work that we work with on a daily basis or on a weekly basis. Some are part of our kind of ambassador program. So we talked from the practical side of that aspect. As far as the research, Dr. Leaf Deacon is our director of research, and also Megan Riddell Smith at Lambton College. They were both instrumental in some of the research portions of the app. Certainly, there's been some really good research come. I'm sure everybody knows the name Dr. Andrew Jones-Bitten and Dr. Andrew Jones, forgive me, and Brianna Hagen as well. We also have worked with a researcher out of Australia, and she has done some really incredible work. And unfortunately, her name is just not coming to mind at this very moment. Caitlin Viro, sorry. It did come to me after all. Dr. Caitlin Viro out of Australia has been very instrumental. We also have worked with a number of other Neufeld scholars in some of their research that is published differently and yet still very relevant. So that's some of the research portions that we've worked on in creating the app.
That's wonderful. Thank you so much for that answer. I'll direct this question to Hedaya. So Gateway Center of Excellence in Rural Health has a program to assist older adults with their technology that's held at the Goderich Legion on Wednesday mornings. And so we're wondering, are there certain technologies that are better suited for older adults?
Hello, can you hear me?
Yep.
Yes.
Okay, yeah, sorry. Yes, that's a great question. Thank you for asking. Based on what we found in the literature, older adults can definitely benefit from the digital health interventions, but successful adaptation often actually relies on simplicity and support. And so, although the technology shows some promise for that population, especially in the rural communities, I would say technologies that have been straightforward, that have straightforward interfaces, larger texts for visibility purposes, fewer steps, and clear instructions tend to be better accepted and better received. And telehealth platforms that mimic a real, regular conversation with a healthcare provider usually are also better accepted and better received by older adults than technologies that require a lot of navigations and troubleshooting and different steps. One thing that definitely kept coming up for me was that the importance of digital literacy in taking up DHIs. So it's not just about its feasibility and its use and user friendliness, but more about how is it actually helping the patient, and are the patients really well equipped to be taking up this technology? And so if we can look or do more research on how we can improve digital literacy and support older adults in rural communities better, I think that would definitely increase the uptake and acceptability of DHIs for this population.
That's wonderful. Thank you so much for that answer. And I will direct this next question to Dr. Mike Beazely. How are pharmacists driving change in the digital space for managing mental health and substance use specifically?
Yeah, so pharmacists are very accessible. They're embedded throughout communities, especially in rural areas. I think and so there's lots of ways they can be a first engagement point for both mental health conditions and or issues and substance use. Um, I don't think I wouldn't say pharmacy or pharmacists are better or less good at knowledge in this area. Um, I think that's why we want to do much more work in demystifying some of these apps. Really, not so much for the specialists. Like I think if you're sort of in a specialized setting with that in works with people who use drugs or people who are experiencing mental health challenges, you're sort of around others, you're around your colleagues, and sometimes word of mouth and sharing papers and sharing links between colleagues can um, can bring you up to speed on what's out there as far as apps and what's working and what's not. And I think if you're a generalist, like a family doc or a nurse practitioner, a pharmacist, a social worker who's not necessarily specialized in those settings, can be kind of intimidating to get started as to which one should I choose, recommend. You don't want to recommend something that doesn't work and or may cause harm. You want to recommend something that'll work. So we need to work with all sort of generalists that work with the public.
That is great. Thank you so much. And I'll actually direct our last question to you as well, Dr.
Okay.
Beazely. But this question is asking if there's anything with the incorporation of AI in apps for
Yes.
substance use and mental health.
Yes. And so um, Hedaya's study would have been from around, I think, 2012 to 2025. And so it would have maybe captured some emerging apps that employ AI tools. But probably there's probably many more, even that were so new that they hadn't really gotten into the literature yet when she did her research. But more and more, I mean, AI is everywhere, chatbots are everywhere. Um, and there was actually an app, I think it was called Yara, that was voluntarily discontinued, I think last year or the year before, out of concerns that their AI chatbot um, may not do very well in those real crisis situations, right? So I think so AI tools and AI chatbots do very well for in sort of daily engagement and sort of bouncing ideas off, talking to something that's responding. But the concern is how they're managing crises. And so I think there's a sense that these tools are going to be great and useful in a lot of ways, but with that caveat of maybe not in for everybody, especially those more serious conditions.
Thank you for that insight, Dr. Beazely. And we'll do one more question, and I'll direct this to Lauren. Do some of these apps involve guidance by a healthcare professional for the individual?
Yeah, certainly the creation of the apps themselves. So everyone on our team is master's level trained as a healthcare professional. That includes doctors, nurses, psychologists, etc. One of the other pieces of that, and kind of piggybacking on that AI question, in our app specifically, when you score, if you score your mood and you score it like low for 5 days in a row or 5 days out of 10 days, an AI bot will populate that will say, hey, I noticed you might be going through a hard time. Can an AIT therapist reach out to you? So we kind of take away that onus on the individual to do the initial reach out. If they click yes, it's considered consent in the background, and our lawyer developed privacy policy and all of those detailed pieces. And so we're excited about that piece because we're hopeful that that will really help stem some of that initial barrier. So again, just as Dr. Beazely said, the AI bot isn't providing the crisis response because that is not, that's not effective or cautionary, certainly very cautionary. But what it is doing is it's able to read some of the data to initiate the live person reaching out and getting and establishing some form of connection. Yeah.
Yeah. And if you look at the sort of spectrum of apps, they would range from purely self-directed, just you and your phone or you and the app, through to basically platforms just to connect with clinicians.
People. Yeah.
And
clinicians,
everything
yeah.
in between. Sometimes the communication with a counselor might be asynchronous, sort of a text chat based thing sometimes. And so the answer is the full spectrum is out there.
That's great. Thank you so much for that response. And thank you to all of our presenters for the webinar, helping us understand the changing digital health landscape for managing mental health and substance use. Thank you for attending our last episode of Season 6. Gateway Center of Excellence in Rural Health webinar will return on September 15th, 2026 for a talk on housing and homelessness in Huron County, plans and progress, featuring Ryan Erb from the Perth Huron United Way, Aaron Schooley from the County of Huron, Rodney Phillips from Huron Perth Healthcare Alliance, and Danielle Johnson from Huron Health System. You will need to register for this new season on a link that will be available later today. And we would also like to thank the following sponsors for their continued support this season and into the next. Without them, the lecture series would not be possible. So we would like to thank CIBC Wealth Management, McGee Motors Godrich, Huron Tel, Libro Credit Union, Lighthouse Money Management, McEwen and Fegan Insurance, Zayres Godrich, DeJaggers IDA Pharmacy, Tucker Smith Communications. Gateway Center of Excellence in Rural Health is a not-for-profit organization with charitable status, and we greatly appreciate and welcome any support we receive. We encourage you to reach out and let us know what you would like to see next season. Thank you again to our panel, sponsors, and especially you for tuning in.